Acute leukemia exists in other leukemia types such as acute lymphoblastic leukemia and acute myelogenous leukemia. The former leukemia type leads to the formation of excessive white blood cells which are ineffective but not necessarily abnormal. These cells are easily clogged in the bone marrow and therefore they hinder the effective output of normal white blood cells. This leukemia type S is mainly common in children between 2–5 years of age. Its main symptoms include high fever, general body weakness, spots of internal bleeding underneath the skin and excessive and persistent bone pain. The latter symptom is common in most leukemia types. Doctors identify the existence of this cancer type from its symptoms. Acute myelogenous leukemia also leads to a massive production of white blood cells which possess some disease-fighting properties but are still inefficient. This condition is mainly noticed in men. Among all the leukemia types known to doctors, this is the most serious type of leukemia. It is mainly a disease of the old and as such it rarely affects children. Unlike other leukemia types, AML is acquired and not inherited from any member in a family line. The main cause of this leukemia is continued and uncontrolled exposure to radiation. Exposure to chemical benzene has also been accredited with causing AML. Chronic leukemia. Leukemia types are broad categories that incorporate other medical conditions. Chronic leukemia is one of the less vigorous leukemia types in the medical arena. This condition takes a substantial amount to develop and exhibit itself in the patient's body. However, after the chronic leukemia is fully developed, it is very vigorous, though less as compared to acute leukemia. In most cases, medical officers are able to prevent death by professionally handling the condition in earnest. Most leukemia types usually lead to death whether in the long or short run. Treatment options offered for leukemia. Different leukemia cancers call for different types of medications in their treatment. These treatment options include chemotherapy. This is a cancer treatment option used for treating most leukemia types in different patients. This treatment option uses very strong and effective drugs to completely destroy and kill the cancerous cells in the bone marrow. Most leukemia types are responsive to this treatment option. Radiation treatments. Radiation is also used in treating most leukemia types and related illnesses. This treatment therapy revolves around the use of harmful radiations to destroy cancerous cells. However, this treatment option is destructive in instances where radiations are not controlled. Stem cell transplant. Stem cell transplants are used in rebuilding the normal white cell development in most leukemia types. The supply of these normal cells in the bone marrow modifies the body's immune system. However, this treatment option for most leukemia cases is not administered single-handedly. Transplant also help in getting rid of the abnormal white cells common in most leukemia types.